Pleased to announce our intent to develop on 14 acres that are behind us an outpatient medical campus. Likely be a mix of traditional hospital inpatient diagnostic and procedural services, as well as primary and specialty physician services. It'll be phased over time, and we are now in the preliminary planning phase. It'll morph over time, so we're planning for maximum flexibility. The first phase, Karen Tobin from Dr. Wadzinski's office is here with us today, and Dr. Wadzinski is planning to open up a clinic in the near future. That'll probably be the first building that will go on campus. He'll build out a little bit of extra room for other specialists from the community to come and rotate through a satellite clinic until we have more space for them to move into. The second phase will be a larger complex with, again, a mix of outpatient hospital, traditional hospital services and physician services. And I anticipate we'll have our own ribbon cutting and announcement in the future, so I'll just leave that as a little bit of a teaser right now. To the good folks at Morningside, I think if you ask your Northside friends, you'll realize that Sioux has been pretty good neighbors over time. We plan to communicate with the folks in the Crispy Road neighborhood as we develop and plan various phases of construction. And we also plan to send out a survey to the folks in Morningside to better understand what kinds of services you all would like to have in this part of town. So with that, again, I'd say congratulations to the city, congratulations to all of us for this nice economic development in this part of town, and thank you.
We'd be happy to take some questions, if you will, either for St. Luke's about the new medical campus, from any of our engineers here about the road that's we're going to cut the ribbon for here in a second, or in a minute, or anything else about the development of this area.
Marty, can you just touch on the importance of having healthcare spread out throughout the city, not just in one area?
I think, and Chad may want to talk about this a little bit because I know they've done extensive work in looking at where the demand is and where the opportunity is for healthcare. Obviously, healthcare, as I mentioned before, is an important component of our local economy. They're typically good-paying jobs, skilled people that work in healthcare, doctors, nurses, technicians, and so on. And we want to encourage that growth. We want Sioux City, development of Lakeport Commons and Sunnybrook in this area has really solidified Sioux City as a regional center for retail, for shopping, for commercial activities. We want to continue to be. We've been a regional center for healthcare for a long time, but it's a competitive environment. Other communities are building up their facilities, and with the growth in population and the activity occurring out here, we have a great opportunity to increase healthcare services here to compete with those other places and to provide better service to the citizens of our community. Chad, I don't know if you want to add anything to that.
Well, I'd probably just add that the southeast part of town here has pretty good saturation with primary care. Not a lot of specialty services, not a lot of what we think of as hospital, outpatient, diagnostic, and procedural services. So we think there's, with almost half the population of Sioux City living on this side of 75, there's probably an opportunity to expand those services. Hospitals were built as inpatient entities. They weren't necessarily built for today's design to accommodate and serve outpatient services, so we think that there's an opportunity there. And then there's just, people are used to coming to this part of town to shop from the town, and it's got great access to all points rural around us, so we just think there's a good opportunity for medical services in this part of town.